Alright guys, welcome back. We're going to be going through our uncommon lunge matrix, hybriding it with the lawnmowers, the pivot lunges, with common and uncommon presses. Again, for these guys, we have 6 different kind of basic dimensions and ways we can kind of press in. We reviewed those very briefly at the beginning of part A of this series. Review back to that if you'd like to. Otherwise, check out the video on the common uncommon lunge matrix with the common uncommon press matrix. So right now what we're going to be heading on into, we're going to be using our common lawnmowers with our uncommon lunge matrix to a pivot lunge, and we're going to be adding the common uncommon presses that I kind of really enjoy, and I'll tell you a little bit why as well. So the first thing we're going to do, we use right foot as our base foot. We use left foot as kind of our lunging or stepping leg. What I'm going to do first, so for a lawnmower, we have a little step across and a little reach. We're going to go posterior lateral. If it's a true pivot lunge, we're going to really load this out of sync rotation. So as you sink on down, and the upper extremity will then be rotating to the right. I like to further kind of disassociate kind of what's going on at the hip, the foot and the ankle, the thoracic spine. In this position, I'll go with my common transverse plane press. So I'm going to come here, I'm going to go posterior lateral lunge, I'm going to load my out of sync rotation with my common transverse plane lunge to further take the thoracic spine and trunk away from the hips, give us that good slingshot-like effect. I'm now going to go with my uncommon frontal plane press, and as I do that, press to the opposite side overhead. I really load up this lateral kind of butt, that posterior butt, to decelerate that adduction. I'll go with a couple more. Posterior lateral pivot lunge, uncommon frontal plane press, and now let's go uncommon transverse plane press. I like the uncommon transverse plane press as I go posterior lateral here, because in gait it really kind of loads up the feet and the ankles on both sides, particularly the right, and that I'm getting this eversion, driving eversion of the calcaneus, the subtalar joint, that mid-tarsal joint, kind of unlock and dissociate that midfoot from the rear foot. I'm driving that medial rotation of the tibia and the fibula, this leg, and of the femur. I'm also driving the pelvis to the left faster and further than what this left leg is traveling, which gives me that good relative internal rotation of that TZ2 hip. So here to here. What we're going to do now, we're going to go through our posterior lunge series with those that are part of the uncommon kind of lunge matrix. And again, we have multiple positions. Let me reverse that a second. So we know we can go anterior, posterior lateral. We know that we can go straight posterior with these guys as well. So I'll take the slack out of the sagittal plane and I'll drive in the frontal plane. Get more mobility at that hip, and right here, what I'm doing at that right kind of foot and ankle, I'm getting dorsiflexion and inversion, similar to that of what I get in TZ2 of gait. I can also go here and then here, load into my lateral lunge. So I'm really driving the deceleration of adduction at that left hip, deceleration of abduction of the right. And with that, if I want to add my transverse plane common lunge right there, I can really kind of further the loading, that rotation, kind of that internal rotation of that back, that TZ2 hip. I can really drive and load that eversion by taking the slack out of the mid-tarsal joint and that subtalar joint, the frontal plane, and now get a little bit more kind of medial rotation of the talus as well as the tibia and the fibula. Posterior lunge series is part of the uncommon lunge matrix. We're going to kind of rock and roll with a posterior medial, as well as a posterior lateral kind of lunge. So what we'll do first, we'll go opposite arm, opposite leg. So we're here, we'll go our pivot lunge, and then I'll drive uncommon frontal plane. And again, with these guys, you can go common sagittal, common frontal, common transverse. Just a matter of what you're looking to kind of get done. You can go uncommon, sagittal, frontal, and transverse. I like using these guys if I want to kind of take up all the slack in that sagittal plane to go after the frontal and of the transverse. So boom, boom. This leg I'm driving that TZ1 kind of gate positioning right here with the uncommon frontal plane right here. I'm really driving that loading of the right butt, of that dorsiflexion inversion of that lead leg right there. You can also, kind of with these guys, go an anterior medial lunge. Further kind of take up the slack in that right butt. I can go transverse plane with the anterior medial lunge, kind of disassociate even further the hips from that shoulder girdle, scapulothoracic spine, and then drive that TZ1 kind of gate reaction, that kinetic linking down at the foot and the ankle. Let's go with our posterior medial and then our posterior lateral. So what we have, we're going to load lawnmower into posterior medial. So uncommon, if we're going true pivot lunge, we're going to go anterior lateral with it. So I like driving this to get a lot of good deceleration of abduction of the TZ2 hip, and adduction, that TZ1 hip, dorsiflexion and inversion of that right foot and ankle, or depending on where I'm driving the knee, dorsiflexion and eversion, which I'm getting right now. So if I drive my foot straight forward, get dorsiflexion and eversion. If I still drive it forward but drive the knee on an angle, I'll get some dorsiflexion and then some inversion. You can also, with these guys, again, take out the slack in the sagittal plane to drive frontal, uncommon, and transverse uncommon. Let's go posterior lateral now. Let's go posterior lateral with it. We're going to load out of sync rotation with our reach. So right arm rotating and reaching to the left. Right arm rotating and reaching to the left if it's a true pivot lunge, which it is for right now. We're here. We're really decelerating that adduction of the left hip, that deceleration of internal rotation, which is so powerful and so needed. So we're here, and then we're gonna pivot lunge, anterior medial, really drive the dissociation between thoracic spine, lumbar pelvic hip complex. And if I want to drive it a little more, let's stay here, rotate that trunk as far as you can, and press. So we're taking up the slack in that transverse plane. Type 2 out of sync motion. So if we're going our lawnmower with a pivot lunge, we're here, lawnmower, the anterior medial with a pivot lunge, we're here. We can also go a straight medial with that to really kind of go after the frontal plane a little bit more. We're here, and boom, and I can really feel the slack being taken out of that frontal plane as I go into that medial lunge. I disassociate even further with that free side arm. I press uncommon frontal plane. I'm here, I'm here. I press to really then drive as I've taken out the slack in that TZ1 kind of foot ankle kind of complex. I really further kind of that loading with my uncommon transverse plane press. Uncommon. So we just went posterior with our pivot lunge. We've gone posterior medial and posterior lateral with the lawnmowers and the pivot lunge, combining primarily common transverse plane presses, uncommon frontal and transverse plane presses. Depending on what you're looking for and looking to do, you can manipulate and tweak these progressions however you want, whether it's scapulothoracic related, shoulder related, whether it's hip related, whether it's foot and ankle for TZ1, TZ2 related. You can drive it to do whatever you'd like. So the next part of this, we're going to take a look at the same things in regards to the lawnmower, the pivot lunges, but we're going to take a look at the common and the uncommon shoulder overhead press matrix with the lunge matrix. But now we're going to look at the uncommon lawnmowers in which we're loading in sync rotation. Please follow us for this. Go ahead and check this out. Play with the guys. Best thing to do is kind of experiment.